The last person in order of time to propose a natural cure against cancer is Tullio Simoncini, an Italian oncologist who finds himself in the middle of a storm after having declared that the origin of cancer is not genetic but it is due to the aggression of a fungus called Candida albicans. Based on this hypothesis, Dr. Simoncini treats cancer with sodium bicarbonate, and his rate of success is encouraging to say the least.
What is a fungus? In other words, how do we get this fungus inside our body, or this yeast inside our body? Where do you think all of this starts after your years of research?
There is an endemic, a big epidemic pollution because the fungus is undervalued. But it is undervalued because it is not understood.
From the beginning of his studies in oncology, Dr. Simoncini felt the need to reconsider the cancer paradigm from scratch, and began looking for a different origin of the disease. What puzzled him the most was the fact that all cancers behave in the same way, even though they occur in the widest variety of organs. He then started looking for a common denominator, and believed to have found it in the fact that most cancers appear white. These tumor specimens show the devastating impact the disease can have on the body. This is a liver riddled with cancer. The whitish bubbles are all tumors.
If you enter in the body and you reach an organ affected by the cancer, you can see that the lumps are always white.
The lumps are white?
Lumps are always white. Sometimes it is covered with blood or with the defense reaction. But in every post-mortem examination, scientists find the white lumps, the white masses, that is fungi. This is the pleura. We entered with the camera and look, the pleura should be red, but you can see all the lumps, all the cancer that is white. This is the heart beating. This is a bronchial cancer. Look, we went into the bronchia. Look, they are white. And then in the colon cancer. This is red because there is a little bit blood. I washed it up.
Okay, and now it's white.
Now, look. It is always white.
White, like Candida. Candida albicans in Latin means glowing white. It should be clarified that the presence of fungi in tumors is nothing new in the medical world. Official oncology, however, believes that their presence in tumors is due to their opportunistic nature, which brings the fungi to build colonies wherever they find a suitable environment. This belief, however, seems contradicted by a careful observation of what happens in the lower hierarchies of the animal world.
Spores from a parasitic fungus called cordyceps have infiltrated this ant's body and mind. As soon as she is discovered by the workers, the ant is taken away and dumped far away from the colony. It seems extreme, but this is the reason why. After a while, the fruiting body of the cordyceps erupts from the ant's head. It can take 3 weeks to grow, and when finished, the deadly spores will burst from its tip. Then, any ant in the vicinity will be in serious risk of death. The fungus is so virulent, it can wipe out whole colonies of ants. And it's not just ants that fall victims to this killer.
In this case, it was the fungus to cause the ant's death, not the death of the ant to invite the presence of the fungus. What normally appears to be a simple opportunist is in fact a full-fledged assassin.
Allora viene il dubbio, non sarà che viene prima debilita l'organismo e poi nel momento in cui la si vede è il momento della massima invasione? Chi ci dice che sia solamente un post hoc? Il fatto che ci sia è un dato di fatto, il fatto che sia un post hoc è un'interpretazione.
So the oncologists and scientists say because the cancer invades the organism, it gets weak, and the candida that is opportunistic invade the organism. On the contrary, I say that the Candida enters to the organism, makes the cancer, destroy the organism, then explodes everywhere.
Candida is a very familiar fungus, known especially to women who sometimes experience an infection in their sexual organs.
The vagina is a muscular canal that leads from the outside of the body to the uterus. The warmth and moisture of this canal create a perfect environment for microorganisms to breathe. For example, bacteria called lactobacilli, which are naturally present in the vagina, coexist with a yeast fungus called Candida albicans. Normally, the lactobacilli create an acidic environment that keeps the natural yeast population in balance. However, when conditions within the vagina change that either decrease the numbers of lactobacilli or decrease the acidity, these yeast fungi begin to multiply.
Normally, the immune system keeps the fungi under control and doesn't allow them to establish colonies anywhere in the body. Whenever a white cell identifies a fungus in the bloodstream, it immediately attacks it and destroys it. If instead the system's defenses get lower than usual, which can happen for a variety of reasons, the Candida can manage to get around the immune system and establish a permanent colony wherever in the body.
Esistono le candidosi superficiali, quelle che attecchiscono sugli epiteli, le candidosi classiche del cavo orofaringeo, della vagina, eccetera, eccetera. E poi esistono le candidosi profonde, quelle in cui la candida è riuscita a sorpassare gli epiteli e il sistema immunitario e è riuscita a radicarsi nell'interno dell'organismo, in un organo. Nel momento in cui un fungo entra dentro il tessuto connettivo nella parte interna dell'organismo, si chiama la candidosi intima, evoca una reazione di tipo immunitario cellulare che porta alla formazione del tumore. Il tumore, secondo me, sarebbe quindi l'insieme dell'invasione fungina più la reazione cellulare che l'organismo mette in campo.
Far from being a wild, uncontrolled cellular replication, according to Simoncini, the growth of a tumor is a lucid and desperate reaction from the organism in a last attempt to reject the intruder. By the same token, Dr. Simoncini believes that metastases are not cancerous cells that leave the primary tumor to go start a new one somewhere else, but small groups of fungi belonging to the primary tumor that fall inadvertently into the bloodstream during biopsies or during normal operations. These runaway fungi settle in a new environment and prepare to take advantage of a weakened organism to establish their own colony as soon as possible. Once this propagation has started, it becomes necessary to restore the immune system to its maximum potency. If the patient is given chemotherapy instead, this only accelerates the destruction of his natural defenses, as the drug kills indiscriminately cancerous and healthy cells. While possibly prolonging the survival by a few months, chemotherapy in fact makes it impossible for the organism to recover its defense capabilities, making it bound to succumb sooner or later to the multiplying fungal attacks. To test this hypothesis, Dr. Simoncini considered treating cancer patients with sodium bicarbonate.
Sodium bicarbonate is the strongest substance against fungi. They cannot adapt to a salt because it is not a complex substance. That's why the antifungal today's antifungal drugs are ineffective, because the fungi can adapt themselves in 3-4 days. For a fungus, you give an antifungal drug, you can kill the first layer, but the second layer they get used and they eat drugs, chemotherapy, everything.
Gennaro San Germano is the first patient ever cured by Dr. Simoncini with sodium bicarbonate. In 1983 he was diagnosed with lung cancer and was given a life expectancy of 6-7 months at best. In 2006, 23 years later,